I'm Kristen Kirby, and I'm a clinical associate professor at the School of Nursing.
Hi, I'm Rebecca Johnson. I'm a registered nurse and a clinical assistant professor at the Purdue University School of Nursing.
And together we're working on a presentation called Diversity, Inclusion, and Equity in our School of Nursing. The Higher Learning Commission and the CCNE, which are both accrediting bodies for Purdue University and the School of Nursing, have position statements and initiatives specific to the education requirements of students related to diversity and inclusion. Diversity and inclusion education is known to increase patient and nurse satisfaction scores, improve the culture of the workplace, and positively impact patient outcomes. But research also shows that many nurses are unaware of the impact of diversity and education, or diversity and inclusion education on patient health outcomes, and they often lack this knowledge and skills in this area. All literature points to three areas: student assessment, faculty assessment with continuing education, and the curriculum. The student assessment focuses on self and others awareness and the development of empathy and the ability to build bridges amongst people. The faculty literature speaks to self-awareness, ongoing clinical education, and recruiting and retaining diverse faculty and faculty who are willing to mentor these behaviors. From a systems standpoint, a systems and curriculum, we focus on promoting partnerships in the education setting, integrating concepts throughout our programs, and using a systems approach to build these skills and awareness. Our overarching goal was to ensure that students and faculty demonstrate competencies that impact patient care based on the 6 constructs of the AAC&U value rubric. In addition to these six constructs, we also looked at 3 separate domains. Again, the student assessment, the faculty assessment and development, as well as the program or curricular blueprinting. From our objective standpoint, we have objectives, again, focused on these 3 domains. We looked at freshman and senior level assessment scores. We looked at faculty assessment, continuing education events, and ongoing education. And then we also looked at our curriculum in terms of blueprinting our undergraduate program. Our SILMAR mini grant focuses specifically on the faculty assessment and the student assessment piece.
For our quantitative data, Kristen and I chose the Intercultural Development Inventory for a variety of reasons. Upon choosing the assessment tool, we were trained as qualified administrators of the exam. The exam itself is a 50-item cross-cultural theory-based assessment tool. It's validated to apply across cultures. It's available in 17 languages, customized for educational use. It has high confirmatory factor analysis, high interrelator reliability, predictive validity, and strong content and construct validity. Generalizable nationally and internationally. So why did we choose to go forward with this research? Well, we needed to assess the current status of our university. Where are we right now? So in order to do this, we decided that in order to make changes, we really needed baseline assessment data. We decided to do so initially, and then after finishing the curriculum, to see how things have changed after they have gone through our program. We wanted this knowledge so that we can use it going forward for how we decide on content that we need to provide the students and also for the faculty. We wanted the ability to provide more culturally competent nurses to not only Indiana, but the rest of the United States. So what we have here is a graph showing our results from our freshmen in the fall of 2018, and we can see that they are in minimization. So the top line up there, the top graph, is showing how they think they are, where they think they are in the Intercultural Development Inventory's continuum from a monocultural mindset to a multicultural mindset. The bottom graph is showing where they actually fall when they are tested. So the top graph, again, shows where they think they are, how others perceive them, and then the bottom graph is how they are actually being perceived by others, where they actually fall on that continuum.
And as you can see in this graph, they were tested in 2 consecutive years, and you can see that 2 incoming classes of freshmen tested almost identical in terms of their scores. From here, we had, simultaneously to the freshman assessments, we were running a small research study within our senior class. Literature outside of the nursing and medical field proved that the intentional work within a course could improve IDI scores within one semester. So we wanted to test that within the nursing field as well. So within this, the next group of results that we're going to show, we have a control and an intervention group. And so within the intervention group, I just wanted to point out what that intervention was. So it was a senior level nursing course, and it was revised to include about 20 hours, 21 hours of specific diversity and inclusion content. And some of these things included a MOOC, or a massive open online course that was titled Understanding Diversity and Inclusion, which was created by Dr. Callahan here at Purdue University. We also used the ATI, which is a nursing specific technology that we use. And within that technology, there was a civility mentor simulation that was created by Dr. Cynthia Clark, and that was part of the 20 hours. Additionally, we used the Harvard implicit bias test that each student was allowed to take, and we used guided discussion questions, self-reflections, and some experiential learning opportunities. So within these scores, you can see the results. The intervention group there on the left and the control group on the right. The intervention group was done in the fall of 2018, and the control group was done in the spring of 2019. And again, you can see we had 61 students in the intervention group and 56 in the control group. And this is just simply based on when the students signed up for this specific class. It is a required course in nursing, but it just depended on when they signed up for the course. But again, as you can see, the pretest scores between the groups were very similar scores. And I'll talk through the independent samples t-test and the paired samples t-test shortly. These are the post-test scores. So again, the intervention group is on the left and the control group is on the right. Again, if you look at the control group between the pretest and the post-test, they had very small movement. It was about 2 points. From the intervention group, they were able to gain almost 10 points within that 15-week time frame. These are the quantitative results in terms of the independent samples t-test as well as the paired samples t-test. Again, the pre-test scores show almost no difference for the independent samples t-test, whereas the post-test scores had a statistically significant difference. With the paired samples t-test, the fall group, which was the intervention group, did show a statistically significant difference, whereas the spring group with a control group did not show a statistically significant difference. And this is just one additional way to depict the data within this bar graph. So again, this shows the independent and the paired samples t-test.
When we began our research, one of the questions we had was whether our faculty are prepared to teach our students about intercultural competence. In order to figure this out, we decided that our faculty also needed to be tested to see where they fell on the continuum of the IDI with regards to a monocultural versus a multicultural mindset. What we found was both surprising and not surprising. Our faculty, for the most part, score very similar to our students, and so do our staff. So what are the implications for practice and research? Our implications for practice and research include that we need to look at the previous research that demonstrates that intentional interventions increase cultural competence based on the IDI scale. And all we did was reproduce this here at the School of Nursing. Longitudinal studies over 4 years focused at providing baseline data for further research is how we plan on proving this. We plan on doing an ongoing blueprint mapping and course revision in the undergraduate program. We have ongoing plans for professional development. And our current data suggests for faculty, staff, and students that we are in a similar position. 2 or more years of data will solidify this answer. So in conclusion, our intentional interventions do work. Here at the Purdue University School of Nursing, we are currently in minimization. We do need buy-in from stakeholders, as that will be critical to our success. And we need to do more research. We have more work to be done.
And we just want to say thank you again to Silmar for the mini grant that is allowing us to do this work, Dr. Callahan for his ongoing support and mentorship in this work, and our nursing faculty, staff, and students. Thank you.